Today marks International Childhood Cancer Day. Now, 55% of children diagnosed with cancer in South Africa survive. A Childhood Cancer Foundation, SA, has pledged support to the World Health Organization in its fight to reduce childhood cancer mortality and eliminate cancer-related suffering. We're joined by Queiros. He's the CEO of Childhood Cancer Foundation in South Africa. Thank you so much for your time this afternoon, Carl. Just, an initial look at that 55% sounds like quite a good survival rate. But comparatively, when you look at how the rest of the world is doing, it really doesn't match up, does it?
Well, good afternoon to you and your viewers. Yeah, it's a 55% if you compare it to developed countries. We're looking at 70, 80, even 90%. So childhood cancer is very treatable. And also bear in mind it's 55% of diagnosed cases. So if you look at normal statistics, we should be diagnosing about 2,500, 3,000 children a year. We're diagnosing about 1,500. So we suspect we're losing half the kids as well. So if you put that into the equation, we probably are not even getting to 55%.
Why is the survival rate, particularly in low-income countries, so low?
Yeah, that's a very good question. So in South Africa, we're fortunate that we actually have good treatment. There are 15 specialist pediatric oncology units in the country. The treatment is there. The issue in South Africa, and it's different to other countries, the issue here is awareness and late detection. So a lot of the time children, the symptoms they present are symptoms similar to other types of diseases. So it's misdiagnosed or not diagnosed, and sometimes they're referred from one clinic to the hospital, and it takes a long time to detect that the problem is actually cancer-related. And by that time, unfortunately, instead of getting to us at stage 1 or 2, they're getting to us at stage 3 or 4, and then the survival rate goes significantly down.
It's so interesting because usually when we talk about cancer, it would be affecting adults. So what are the main cancers that affect children?
So the main one of children is leukemia, the cancer of the blood, and then tumors, like brain tumors. So they're different to the adult cancers, and I think that's part of the challenge. And they're not lifestyle related. Talk about adult kids smoking, drinking, whatever. That's not the case with childhood cancer. And it is fairly rare, which is why a lot of the children go, even if you go to a well-experienced GP, they'll miss the symptoms. So that is part of what we do, is to raise awareness by bringing training and education to medically related folks, doctors, nurses, traditional healers, home-based carers, ever, so they can pick up these symptoms quicker and get them to treatment. Because as I said, the treatment is there. When you're talking about, in other cases, no problem, when you talk on the rest of Africa, because I also sit on the Africa Committee, the challenge there normally is actually resources. 80% of the children who are diagnosed with cancer sit in low and middle income countries, whereas 20% of the resources sit there. So this is why we're partnering with the WHO, the World Health Organization, to bring better treatment and resources to where most of the children are actually being diagnosed.
Do you find that it affects a particular demographic, or is it just across the board?
It's across the board, and if you look at who we support, it pretty much follows the demographics of the country. So yeah, everyone is affected by cancer, rich, poor, different cultural groups.
And I'm wondering, how do families then gather the necessary support to actually ensure that their children receive the right treatment? Because even for adults, it's quite a lot of money to be able to go through the full process. And many medical aids, you find, don't have that cover, or some people just don't have access to medical aid.
I think in terms of the treatment, we're quite fortunate in South Africa. The medical aids cover quite a lot of it, and if you don't have medical aid, there is government care and support, as I've said. The problem, and I was very interested to look at your previous insert of Maputla, I think it was. And so there's a good example, transport. So think of the treatment centers all in the cities. So someone who's coming from a far area, rural area, how do they get to and from the hospital? So this is where CHOC comes in. We provide accommodation, transport, practical support, financial support. Because sadly, when a family comes, a child from a family from a very poor family, they might not continue with the treatment purely for financial reasons. And that's tragic. I mean, so CHOC provides all of that free of charge. The other big thing with that is the dramatic nature of childhood cancer, both for the parents and the child. So we provide the psychosocial service, counseling, guidance, just general advice on what this treatment means to you. So it's medical, It's psychological, it's financial, and it's also practical support.
What can people do to get involved, and where can they go for more information?
Well, they can go to our website, choc.org.za. They can phone us on 086 111 3500. They just Google us and they can call in. They can volunteer. Obviously, financial support's important. We want to provide all these services free of charge. But awareness is very important. I want to come back to it, because if we can detect those children with cancer earlier, we can push up that survival rate and get it to the 80s and 90s.
You know, of course, you don't just deal with children, but you also deal with those that are entering their teenage years. And what kind of support do you offer them? Because it's such a sensitive time in a child's life. They're trying to form their own identity, and I imagine there are other kind of pressures that they have to deal with.
Absolutely. So children and teenagers especially are having to deal with the changes to lifestyle, and they're now also dealing with this disease. So they're also missing out. You can imagine you're stuck. This is not a quick treatment of weeks. This is months, even 3 years, 3.5 years. So now you're in hospital, you're in the CHOC house, you're away from your peers, you're going through puberty. You have questions about, well, what does this mean? Can I have children one day, etc. So there's a lot of counseling and guidance that we provide. And so we do this in two ways, either with professional psychologists and social work, which we employ and place in all of the pediatric oncology units, but also the parents themselves and the teenagers themselves form support groups. Because obviously a teenager who's been through it, or a parent who's been through their child, can advise another parent who's just starting on the same journey.
Yeah. So
that support is very important.
All right, Carl, well, we certainly wish you all of the best in your endeavours. The website again is choc.org.za, and whatever assistance you can offer, and in fact, if you just need more information on those childhood cancers, you can go onto that website. CEO Carl Queiros joining me in studio.